extremity. We'll work on the entirety in one go. So, as we know, we've of course got our 6 meridians on both sides of the arm. On the posterior side, so far we've really only worked on the small intestine meridian, and that's going to be going all the way from the hand up to the shoulder. That's a yang meridian that goes on the back of the arm, but we also want to work on the yin meridians, which go into the chest. Now when it comes to working on the chest, which is the anterior shoulder, it's quite important, particularly when we look at people with medially rotated shoulders. So medially rotated shoulders, the easiest way to tell is actually looking at the back of the hands, not so much the shoulder. So if you see somebody and the back of the hand is pointed towards you, that's a medially rotated shoulder. Versus if the thumb is facing forward, that's a normal healthy shoulder. So you see, if you look at my shoulder, it's kind of hard to tell the difference. You can see a little bit of a difference, but really looking at the back of the hand is the easiest way to tell. So it's medially rotated shoulders, and then we have slumped shoulders. So slumped shoulders is a combination of medially rotated shoulders, protracted scapula, and forward head posture. So that's when people come in complaining of rhomboid pain between the shoulder blades, right? Now the pain is between the shoulder blades, but the problem is on the anterior chest, particularly pec major and pec minor. So that's the anterior shoulder. Now there's more points we could work on the kidney meridian right beside the sternum, but we're not going to be doing that. We'll largely focus on lung 1 and lung 2. So we know how to find lung 1 and lung 2. We'll start with lung 2. Find the deltopectoral triangle. It's going to be made up between the clavicle, the deltoid, and pectoralis major. Nice soft spot. And we'll find the coracoid process by going into that deltopectoral triangle and then passively flexing it. Just relax that a little for me. Good. Passively flexing and extending the shoulder until we found the coracoid process. Once we found it, we're on lung 2. Go down about 1 thumb width, we're on lung 1. Now lung 1 and lung 2 lie directly over top of pectoralis minor. So once we start to press, suppress, do any of our techniques on these two, we're working specifically on pectoralis minor. But just try it on yourself. Find lung 1, lung 2, deltopectoral triangle, and then press. Doesn't take much pressure before you're going to stop. It's not comfortable. It's painful on most people. So there's a few reasons why. One is it tends to be adaptively shortened and quite tight on a lot of people. Another reason is pec minor lies underneath pec major, which means we're pushing through one muscle to affect another. So it can be quite uncomfortable. Nevertheless, we can work on these and do pressing and suppressing. Now notice I haven't talked about many other techniques because we're not going to be doing any pushing techniques in this tiny little area. So I would start with some kneading. So standing at the side of the table, again this table is quite low for me, but I'll get into a nice low horse stance and I'll just use the pads of my fingers. Start on the deltoid and then millimeter by millimeter move towards the midline until I'm on lung 1, lung 2, which is on that pec minor. Now the reason I'm starting laterally and slowly working in is because the chest, of course, is a vulnerable area. We'll be asking permission anytime we work on somebody's chest. So very slowly, is it okay if I work on your chest? Okay. Good. And once I'm on pec minor, lung 1, lung 2, I'll just do some gentle kneading. How does that feel? Good. Good? Yeah. Now, I don't want you going much more than lung 1, lung 2. It's something that eventually, if you continue to pursue massage, you will learn how to massage the entirety of the pec major, pec minor on both men and women. But for this practice, we're just focusing on that tiny little area of lung 1, lung 2. So we'll do our kneading techniques, and then we'll move into our pressing and suppressing techniques. So for our pressing technique, I forgot to take the ring off. For the pressing technique, we start with lung 2. You could start with lung 1. I'll just say I'm going to start with lung 2. You notice I shifted my position because I want my vector of force, that's the direction in which I'm pushing, to be into the rib cage. If I were to stand right here, I could push into the rib cage, but what tends to happen is you end up pushing more towards the neck, and it's more uncomfortable, and we're not focusing on the pec minor nearly as much. So I move up towards the top of the table, and my trajectory is kind of semi towards the midline and also a little bit along that meridian, moving from lung 2 down to lung 1. So with reinforced fingers, my pressing technique first is nice and gentle, remembering we're not getting into a 5, maybe 6 tops, but usually a 5. And we'll know that through communication. And after I've done that for a few seconds, I'll do some kneading, and then we'll get into our suppressing technique. Now, I feel a trigger point on pectoralis minor right there, which is on lung 1. You'll find out of the two, lung 1 tends to be more sensitive than lung 2. So I'm on lung 1 now. Now, what I want you to do is tell me when we're at a 7 out of 10, okay?
Okay.
Okay. So stacking my joints, getting nice and tall. Now, of course, because this is a demonstration, I'm looking at all of you, but I'll make eye contact. I'll look at their expression. Because sometimes they're like, oh, I'm tough. I can handle a 20. Right? We don't want to look at their eyes. Eyes don't lie. If you don't want to look at their eyes, look at their toes. Eyes and toes don't lie. You see the toes curl, you see the eyes wince. So we can know our pressure without communicating. All right, so again, tell me when we're at that 7.
Oh.
There we are.
Yeah, yeah.
Do you feel it refer anywhere?
No?
No, just right there in that spot?
Yeah, yeah.
Good. Tell me when it goes down to a 4 out of 10, okay?
Okay.
Good. And once it's down to a 4, you know the drill, a little bit of kneading. Right, you can use the knuckles as well if you find that more comfortable. I would not use the palm of my hand, of course. That's an inappropriate way to make contact, so it's just pads of my fingers. And there's no need to use your thumbs here. We don't need that much force. So I'm just using the pads of our fingers. So that's lung 1, lung 2. And I'm going to move down into the rest of the arm. Now, around the shoulder, it's going to be large intestine and sand jaw meridian largely. We can do this either in a prone or supine position. In this position, I'm going to be working on large intestine 15, sand jaw 14. As you know, we worked a little bit on that before the break, but that's going to be in between the two heads of the anterior and middle deltoid, middle and posterior deltoid. Easiest way to find that is to abduct the shoulder to about 90 degrees and then just palpate a little bit. So I feel the anterior deltoid here, I feel the posterior deltoid right there. So once I'm in between those two, acromion right there. That's large intestine 15. So I can passively move the shoulder. And the reason I'm going to be passively moving the shoulder is it gets the deltoid out of the way so I can get a little bit deeper. How's that feel?
Good.
Good. So here, just using my fingers, and I could curl all of my fingers, just use the tips of my fingers. I can do a little bit of kneading. And if I want to get a little bit deeper, so right now I'm just kneading like this. If I want to get deeper, I just curl my fingers a little bit more. And so you can feel the difference there between here and here. Stronger?
Yeah.
Less strong.
A little numbness.
Yeah, a little numb? Fingers?
Yeah,
Yeah. Okay, if there's numb in fingers, that's pec, relax that arm. That's the pec minor.
Yeah.
That's thoracic outlet syndrome. It's not the scalenes, right? Thoracic outlet syndrome has 3 possible locations. Remember, we did those tests. We've got the scalenes, costoclavicular, so that'll be the clavicle and pec minor. In this position, if that's causing numbness and tingling, that's a tight pec minor pushing on the brachial plexus. So knowing that, if this were an actual treatment, I would spend much, much more time on lung 1, lung 2. Lung 1 and lung 2 are the best points we have to release the pec minor, thereby releasing thoracic outlet syndrome, pectoralis minor syndrome in particular. Right? So let's relax that arm. Now I could do some kneading on the entire deltoid. Notice I'm still controlling the position of the arm with this hand. I can switch hands. When I'm working on the shoulder, I never just let it sit there like that. I always want to have control. And as I move the shoulder around, I gain access to different depths of the deltoid. I can work posteriorly as well with the tips of my other fingers, so relax that arm for me. Good. So now I'm just working on the posterior shoulder, doing some kneading with the tips of my fingers here, okay? Now we've already worked on that within the small intestine meridian, so I won't spend a lot of time. So far so good on the anterior shoulder. Now we'll move into the arm itself. So along the anterior side of the arm, we're going to be focusing on all of the yin meridians at the same time. I'm not going to specifically work on pericardium, lung, or heart. I'll work on all of them. So in the bicep, what I'm basically doing now is pushing along the entire bicep. Now what I want you to notice is I'll change the position of the shoulder, work on more of the medial fibers. That's going more into the heart meridian, right? Then I can work right on top of the bicep. That's a little bit more lung meridian. And then PC is kind of in between. But I can shift the position of the shoulder, which will shift part of the bicep that I'm working on. Instead of moving my body into a different angle, I just move that joint. So that's just some kneading combined with pushing, right? You do the same thing down on the forearm. So, I'm gonna move your sleeve up if that's okay. Within the forearm, what I'll do a lot of the time, so I use the back of my hand. We're not using any oil, and the reason I like the back of my hand is it has a little bit more glide, it's a little bit smoother. So if I'm moving more quickly like this, it's going to start to generate some heat. If I move a little bit more slow, I have a better ability to palpate. If I want to use the palm of my hand, I can, but what you'll find is the palm of your hand is probably a little bit sweaty, right? You'll stick. You don't get as much movement, right? Like I'm trying to, but my hand sticks. That's why I like the back of my hand for pushing. And then we could switch. We could do the young side of the arm, the extensors, doing the exact same thing, moving up and down. Now, one part I did not work on is the triceps. With the triceps lying in a supine position, the easiest way is to bring the arm up over the head. You relax that hand for me. And we could put the hand either like this, or we could put it like that and hold. It's up to you, and then we could do the same thing. Just hold on to the sleeve, and we could do arm pushing techniques. Some light grasping, some kneading, all of our same techniques working on the posterior side. All right, so our superficial techniques, now we're going to be moving into deeper techniques. Within the entire upper extremity, you can certainly work on the biceps and triceps, but for the sake of focusing on the most common areas of dysfunction, it's going to be in the forearm itself. Right? Remember, arm, forearm. So within the arm, really you don't injure your biceps and your triceps that often, with the exception of bicipital tendinosis. So the forearms, however, they're very regularly injured, if not just sore. In our particular field of work, they're sore on most people, right? The flexors and extensors, very common to have tendinitis. So on the extensor side, really the primary meridian that is pathological is going to be the large intestine meridian. The large intestine meridian goes directly along the extensors of the forearm. So in large intestine 11, it lies over extensor carpi radialis longus. So this big extensor muscle, if you extend your elbow, you'll be able to feel that big extensor muscle. So that's large intestine 11. And then as we move towards the hand, large intestine 10, 9, 8, 7, right? It goes right down the middle of the extensor glute. Now certainly the Sanjiao meridian is going to be on the extensors as well, but it's not as useful, I suppose, when it comes to treating just the extensors. So I'm going to start by working towards the elbow, and this is where we'll have lateral epicondylitis. So I'll begin with my kneading techniques, which are a little bit deeper. So I'm using the entire palm of my hand right over top of the elbow, going down into the extensor group. And by the time I get close to the wrist on the extensor group, I'm not doing too terribly much, right? And as we did before, we can either work on the entire meridian using our kneading techniques, either going nice and slow, going a little bit faster, depending on what you prefer, or I could start to isolate specific points. I can't do a kneading technique on large intestine 11 because the lateral epicondyle gets in the way. But large intestine 10, 9, and 8, I certainly can. It's using the entire palm of my hand, just distal to the lateral epicondyle. I can push down quite firmly and begin to get into a deeper kneading technique. Again, making eye contact, making sure that you're not getting any signs of pain and discomfort. Okay. Now, I would spend quite a bit of time working on the extensors because there's really two reasons why I work on the extensors. One is just they're sore and relaxed, in which case we're done, right? But the more common reason is somebody has an injury, tendinitis, tendinosis, sprain, right, lateral epicondylitis. If you feel your own forearms, you probably have a little bit of scar tissue in it. So that means we're going to be doing deeper, and in this case, we'll eventually work our way to the plucking technique, which we have not done yet. The plucking technique, by its nature, is injurious. It causes damage. That's the point of it. That's why we're doing it, to cause controlled inflammation. We do it to break up the scar tissue, or we do it to break up a strong amount of blood stagnation from the principles of Chinese medicine. It's a very strong technique, and again, it causes damage. The reason I stress that is unless you know precisely where you are doing this technique, why you're doing it, don't do it. And also, we don't do this technique unless we've done our sufficient warm-up. Take your time, because it is painful and it is deep. So you'll do your kneading, your pressing, your suppressing, all of these techniques until eventually, maybe 20 minutes in, we'll do our plucking. So let's move forward now after we've done our kneading with some pressing and suppressing. So working on large intestine 11 first, we could do it in two positions, either with the arm extended, or we can flex the elbow a little bit on the belly. With a flexed elbow, this puts that muscle into a slightly lax position. It relaxes it a little bit. When you put a muscle into a laxed position, it hurts less when you press it. When you stretch a muscle out, it hurts more when you press it. So, I'm going to use the exact same amount of pressure on large intestine 11, and for the sake of this, I'm not going to worry about how I'm doing it, but I'll just push in a large intestine. How does that feel?
Good.
Fine, yeah. Now I'll just extend that out, but how does that feel?
A little soreness.
Yeah. Not much.
Not much.
And sore. Right? So we see by stretching that muscle out, it increases the intensity of sensation, which we may or may not want, right? So again, either position is okay. So our pressing and suppressing techniques, because it is such a small area, you will use your thumbs or your fingertips. You can also go in this position, right? So if I'm using my fingertips, large intestine 11, as we know, is directly in between the lateral epicondyle and the lateral portion of the crease, of the cubital crease, and it is right in the middle of the belly, extensor carpi radialis longus. Right, so again, it's that large extensor muscle when you extend your wrist and flex your elbow. Okay, so once I found it, using my fingertips, I can do my pressing techniques. And I'll do pressing down the large intestine meridian. Typically, I do pressing, suppressing back to back. But just to switch things up, let's do all of our pressing first. Large intestine 11, down. I'm going to use just the tip of one finger now. So this, I don't think I've shown you this one before. So if I use just the tip of one finger, I can press, okay? If I want to increase the intensity, I just take my other hand, push on top. Okay?
Yeah.
I could do the same thing with the thumb if you have that degree of mobility, right? So I could take my thumb and notice I'm really curling my thumb into, in this case, large intestine 10. Large intestine 10 is very tender. On almost everybody, large intestine 10 is tender. There's usually scar tissue in there.
Oh.
So I could do, scar tissue, a history of tendinitis, right? So I could do my pressing technique nice and easy. If I want to do my suppressing technique, instead of pushing harder with my right hand, I could just take my left hand, and as you can see, I've got a curled thumb. Just take my left hand, stand up, push my left hand into my right hand. Tender. Oh. Right. So I didn't change anything, I just put this hand on top. And I can move down each point on that meridian. And if I want to, I can go all the way to the head. But what you will find is there's very little reason to in the distal portion of the forearm. There's not a lot of pathologies that occur down here. So we'll largely focus on the large intestine meridian close to the elbow. All right. So you get the idea of pressing, suppressing, going down. Now I'm going to show you the plucking technique. Now, as I mentioned, the plucking technique is injurious, and what I would suggest you do is prior to trying it on any client, practice it on yourself. So very easily, just take your arm in front of you, curl your fingers around your extensor group, and you want to be on the radial side of the extensor group, right? So you know you've got brachioradialis. You want to be in between brachioradialis and your extensor carpi radialis longus, right? Once you're there, squeeze and then flick. Oh my God. Or you can actually hear it, right?
Yeah.
Oh. Ah. That's no fun for any. I don't really mind it. I'm weird. Well, that's not bad. That's all right. But that's using a very modest amount of pressure. I'm really not trying that hard. I'm making it audible so you can understand that I'm flicking or plucking the muscles like a guitar string. And that at the level I'm doing it, it's not injurious. It's just uncomfortable. So just imagine if you're doing it to yourself and it's uncomfortable with mild amount of pressure, how much pressure we have to use to actually create an effect on this technique. So to reemphasize, do not do this technique unless you know the precise location of injury, which you would do through resisted testing. So let's say, for example, the technique is on large intestine 10, which quite frankly, it usually is. More often than not, it's within, a centimeter of large intestine 10. So you know how to find large intestine 10, you know how to find the lesion. Once I find it, I'm going to make sure my body mechanics are perfect. So I'll stand at the side of the table, horse stance, facing the table. I'll find that lesion, the issue, with my thumb. I'll take my other thumb, reinforce. Now notice my fingers. My pinkies are on one side, or I could use more fingers than that, doesn't matter. My other fingers are curled around, and I now have a very firm grip of that arm. Very firm grip. It's not going anywhere. Take my thumbs, find the location. I feel that muscle flick. I'm not actually going to do it, Tara, just so you know. Stand up nice and tall. Lean your whole body weight in and flick. Just like you're plucking a string, plucking technique. So that's not very comfortable, right?
Yeah.
And I'm using no effort at all, but it's a lot of effort. Now, what tends to happen is you'll be lucky to get 5, maybe 6 plucks. It's also called cross-fiber friction. You'll be lucky to get 5 or 6 before they pull their arm away or before they're like, I can't take it anymore. It's very painful. So get 4, 5 plucks and stop, and then do everything you can to apologize. I'm so sorry. I'm so sorry. But you're not done. You got to do it again. Right? You got to do it 2 or 3 times in order to get the amount of inflammation necessary to start creating a healing response. But this time they're ready for you. Right? They're like, oh, I know what's coming. I don't want that. So the first time you're like, okay, we're going to do this on 1, 2, 3, go. Next time you do it, you're like, are you ready? 1, 2, and you just jump in. Right? And I know it sounds horrible that you're kind of making a trick, but if they tighten up, mixing's worse, which is why you're paying attention. If they're staying relaxed for 2, 3, 4 strokes, perfect. But as soon as they start to tense, stop. You're done. All right? So that's our plucking technique. Now, an essential part of plucking is after we're finished and we do our I'm really sorry techniques, right? Kneading, we make them feel great, do whatever we need to. We have to stretch them. Have to. So to stretch, we'll extend the elbow. Flex the wrist. I'm going to hold the elbow with the cubital crease facing the ceiling. Flex the wrist. And externally rotate the forearm. So you see I'm twisting in opposite directions. Is that okay, Tara?
Okay.
Yeah. Now, Tara has great mobility in those wrists and elbows, so we're getting quite a bit of movement. But you want to stretch that out afterwards. Okay. How are we doing? If you had enough, practice that, and we'll do another part of the arm. That's great.